I wanted to take a minute today to talk about pain behind your shoulder blade, and more specifically, chronic pain. This pain can be unrelenting and make your day a lot worse than it needs to be. And there's usually a few repetitive strains that are happening throughout your day that are causing this to be chronic. What we're gonna do is touch on those, and I'm gonna tell you 2 things you should absolutely avoid in order to make this feel better. Specifically, the pain we're talking about is deep, unrelenting pain that is under your shoulder blade. This isn't the pain that's gonna stop your day completely, but it's gonna make your day miserable. Sometimes this pain can be hard to pinpoint. It's very diffuse, and it's in a hard spot for you to reach and really put your finger on where the pain is actually coming from. With some people, this pain can refer. So it's common for this to refer down into your arm, and another spot that it can refer to, if it's high enough up on the shoulder blade, is into your neck. And if it's really irritated, you might even have a difficult time turning your head to the same side. A scary thing that can happen with this type of pain is it can refer around to the chest. And when it's on your left side, it can actually make people believe that they're having a heart attack. I've met countless people over the years that have come in to see me to try to figure out what this pain is coming from after they've already been to the emergency room, had all the heart attack tests done, and they all come back negative. And as soon as I palpate their spine, I can usually find that spot pretty easily. And with a little bit of pressure there, it recreates all that pain they're feeling, even wrapping around into their chest. So what is that pain, you ask? Well, usually it's where you have the ribs and they come and attach to the spine. So if the spine sat in the middle here, your ribs come from the sternum and they wrap around to the back. And there's 2 attachment sites for each rib onto the vertebrae. Now, if you think of a ball and socket joint, similar to the joint in your hip, you have the ball and then you have the socket, and it sits in there nicely and it creates some stability. These rib joints that attach to the spine are less like a ball and socket and more like a mini Louisville Slugger against a dinner plate. So there's not much stability in there. What creates the stability is actually small muscles and ligaments that help to maintain the stability in the joint. Over a period of time, if you have bad repetitive stress to one of these areas due to being right-handed or left-handed or chronically in the same position, what can happen is certain areas will have more stress and they'll kind of slide out of place. This is called costovertebral dysfunction. This is a common syndrome, which a lot of times we refer to it as a rib being out of place. As I alluded to a minute ago, it's usually caused by repetitive strain. And there are 2 things that you absolutely want to identify if you're doing, and if you are, you want to avoid doing them in the first place. Number 1 is overreaching. When you overreach, you actually cause rotation in your back and you cause the ribs to want to pull off the spine ever so slightly. And if one area is chronically irritated already, it's going to cause more inflammation and more pain and stiffness in that area. This actually happens to me a lot when I play guitar for long periods of time. So I play acoustic guitar, and when my right arm is over the body of the guitar, it actually causes a lot of pain and stiffness if I'm not in a good position later that day or the following day as well. And there's 2 really common repetitive strains that I see people do on the day-to-day basis that are causing this to stay irritated. Number 1, if you work a desk job, it's sitting at a desk and reaching for your mouse. If you're reaching for that mouse and you're overextending and you don't have support under your elbow, then it's a recipe for disaster when it comes to that area of your spine. The most common presentation of this is pain under the right shoulder blade, and it's for this reason. Most people are right-handed and they're constantly reaching for that mouse all day at work. So what you can do to stop that is pull the mouse so it's adjacent to the keyboard, get some support under your arm, and keep the desk at elbow level so you're not raising up or that you're not having to reach down for the mouse. The second type of overreaching that people do is when they're driving. So if you're commuting long hours each day to and from work or traveling on the weekend, if you're driving with one arm up on the steering wheel, you're almost certainly going to have some of this rib tension or pain under the shoulder blade if you're doing that for a long period of time. So say 20 to 30 minutes even a day, you're gonna start noticing that happening if that's your go-to driving position. If you drive a standard car, this typically happens on the left shoulder blade because most people are holding the wheel with the left arm and they're using the gear shifter with their right. So to counteract this, just try to pull the wheel a little closer to you. Rest your hands underneath the wheel and have support on each of your elbows to take strain off of your mid-back. Now, the number 1 stress that people are usually not aware of, and it's pretty obvious when you actually give it some thought, is your sleeping position. So if you suffer from right-sided or left-sided shoulder pain that's deep, boring, and chronic underneath your shoulder blades, Ask yourself, are you a side sleeper and what side do you sleep on? Typically what I see is people that are a right-sided sleeper, because the shoulder is tucked in underneath their body weight, and with their pressure of the body weight pushing down, it gets a lot of strain up in the upper back, and it really wants to pull those ribs off of the spine. Think of this example. If you sleep on the couch for 10-15 minutes, if you fell asleep and you have a sore neck afterwards, imagine what's happening if you're in that position with your shoulder tucked underneath for 2 to 3 hours a night. This can lead to chronic tension in through the back. And if you're noticing you're stiff first thing in the morning, then you should seriously consider changing your sleeping position when you fall asleep at night. Now, you can't control what happens during the night while you sleep, but start the habit off of sleeping on your back or on the opposite side to start your sleep, to start the evening. And once you start developing that habit, you'll find that you're waking up more on the opposite side rather than that sore side. And if you share the bed with a partner, then switch sides with them, because you'll probably just naturally roll to the other side. So hopefully those tips help. Try them out and hopefully you get some good results.